Okay. Another question submitted by a CURESZ Club member was about academic anxiety and imposter syndrome kind of related together, and another good topic. I'll start off by somewhat normalizing it and saying, hey, you want some degree of tension, anxiety to help you perform at a better level. It's not always a bad thing. And as you can see here on this famous graph from 1908, if you didn't have any anxiety or tension, you probably wouldn't go to class, you wouldn't study hard, and you'd probably fail. But if you have a healthy degree of anxiety, stress, tension, it actually encourages you and fuels you to study and, hey, I got to do my homework every single day. And it actually improves your attention. But it's an upside down thing. If that's too much, you start to go down the other side and you start to get more anxious, distressed, fatigue, exhaustion. You see how it breaks down the other way. So the key is to keep it in this healthy, optimal range to help you perform at your best. So when it becomes excessive is when we run into academic anxiety problems. And typically this is 6 weeks or more. And sometimes people will even throw the term clinical in there to denote that it's clinical enough to where they're going to have to get treatment for it or seek out attention from a professional to help them with. So it's generic. Anxiety is too generic. So you want to break it down into 4 components. You can have mostly worry, emotionality, task-generated interference, and study skills deficits. And trying to identify which one you have the most of is really important because, like we said, with deciding whether it's more medical or more mental health or more brain versus mental health, it's going to affect your treatment and what you do. So worrying about it is pretty straightforward. It's just, random thoughts of, hey, I'm going to fail. I'm not good enough. I'm, worried about doing poorly. And it's just not helpful. It's all negative stuff. And you get kind of cognitive distortion, as we call it. So you can reverse that through positive mental imagery that athletes do all the time. Academics can do that. But also kind of catching your negative thinking and your self-defeating thoughts and distortions, catching them, correcting them, and modifying them is the basis of what we do in cognitive behavioral therapy. That's exactly what they do. So that is kind of the treatment for academic anxiety from a worry standpoint. And don't underestimate the power you can have to do that on your own. There's a lot of stuff online that you can work through. This is a classic book we recommend all the time to patients with depression and anxiety to kind of correct that distorted thinking. There's plenty of evidence out there to support self-hypnosis, mindfulness-based stress reduction techniques, and meditation. And again, I have no affiliations with these, but a lot of people do get benefit from apps like Calm or Muse, which actually does a version of neurofeedback to help you stay in that kind of zone of healthy brainwave activity to kind of help you keep on that peak of that curve that we just looked about. Emotionality, this is kind of more like where you just have biological, physiological symptoms of your heart's racing, you're sweating, you feel tense, stiff. The most effective strategies to combat that is to do what we call progressive muscle relaxation. You can do it anywhere you are, class, home, car, wherever. It's just like 4 or 5 steps, and it's very effective. The other thing is what we call, therapeutic breathing. This is called the 4 square technique of breathing. Breathe in 4 seconds, hold it for 4 seconds, breathe out 4 seconds, hold again, and that's a square. And you just mentally do that until you're calmer. That emotionality is lessened. So these are really high yield techniques. Task-generated interference is where you keep doing something that interferes with your grades and, looking at the clock, just doing things that don't work for you, and that leads to problems. You're not going to get as much out of the other things, treatments, as this. This one really, you got to work on your study skills. And a lot of schools have, these guides or these counselors that help you identify the thing that's interfering and try to correct it. Same goes for study skills deficit. Something's not right, and again, that's going to need probably some went the wrong way. Some study skills assessment and counseling to kind of help correct. So the next one they asked about was imposter syndrome, and this is something you hear more and more about over the probably last 5 to 10 years, where you self-doubt your abilities and feel like you're a fraud or an imposter and don't belong there. A lot of self-doubt. Interestingly, this affects more people that are high achieving who find it difficult to accept their success for whatever reason. This is especially prominent in medicine. I don't care what level you are, pre-med, med, attending, chairman, it runs rampant through medicine. The worst thing you can say to a medical student is, how'd you get into medical school? Because it's just not good. Michelle Obama is a very good example of somebody very successful, but she's very open about her own imposter syndrome. And she has several YouTube videos I would direct you to, and she describes it really well. And again, you just don't think you deserve the accolades. And it's not considered a psychiatric diagnosis, more of a kind of a social thing that we're dealing with, and a phenomenon that's equal amongst men and women, and pretty commonly leads to depression and anxiety, which is where it becomes more psychiatric in nature. So this is kind of a person getting a Employee of the Month award, and actually he doesn't even appreciate it because of this imposter syndrome. So I got to watch my time, but you really have to start asking some tough questions like, why am I feeling this way? And digging into that, leaning into it, whether it be on your own or with a counselor or with your therapist. And these are some real world recommendations that I would recommend that you look at. I'm not going to read them all for the time, but the ones that I liked are on the second one. Really be careful to compare yourself. There's really no good that comes out of that. Also, the big one I think for this generation is use social media, mildly or minimally or moderately, not excessively, because that's where you get into this comparing things. Those are probably my two most recommended ones on this slide here. So this is a good question with limited access, another CURESZ member question. Review some recommendations on how to deal with depression and anxiety when there's access to care challenges.
Also, Dr. Resch, you got about 10 minutes to go, okay?
Okay, thanks. I'll try. So basically, this is a good question. I'll make a couple recommendations to try to get yourself, timely, local, accessible, safe mental health treatment. First, tell yourself, hey, like most medical conditions, depression, anxiety tend to be episodic. They're not constant. So tell yourself, through mantras, this is only temporary. I'm going to get better. This too shall pass. I've gotten better however many other times I have. And you also have to say, hey, depression and anxiety, they're some of our most treatable psychiatric conditions. And we fortunately live in a time where we just don't have one modality like therapy. We've got therapy, we've got tons of medications, we've got neuromodulation techniques, other therapies that we combine. So it's a good time to get treatment. Keep reminding yourself that, kind of like that positive imagery. And the good news is, care has never been more accessible. The pandemic has made telemedicine very common. I never did telemedicine until the pandemic. Now it's like you don't even think about it. Most colleges and universities, since some of you are there, are more aware of mental health conditions, and they have formal mental health treatment protocols and pathways that you can work through and with. I'll also remind you that not everybody needs to see a psychiatrist or a psychologist. The first line truly is your primary care doctor for straight depression or anxiety. And they're more than capable of prescribing those effectively, safely, competently. And that's usually where it starts. Only the more complicated cases tend to filter through the psychologist, the psychiatrist realm. There's a new phenomenon called behavioral health integration, where they're putting psychiatrists with me like me, with primary care docs for like an hour a week, and we just talk about cases, and I give them recommendations, and it works really good. That's a more efficient way. So I do that with 3 primary care offices locally, and that's more and more common. At Ohio Health, the system I'm at, we're in 75 of 140 primary care offices, and we're planning to implement that more. So that's a thing about access that you might not even know existed unless you hear about it. And then if you're in crisis, any major sized ER is going to have a mental health professional there 24/7, 365 to help manage through crises and triage to the best level of care for that person. A lot of people think it's like a binary thing, inpatient, outpatient. Well, there's like 3 steps in between as well. There's intensive outpatient, partial hospitalization program, aftercare services. There's plenty of things that a lot of people just aren't aware of to access. Also, another question, look at some alternative recommendations for mental well-being while awaiting to get into a provider for diagnosis or treatment. And here again, there's a lot of things you can do while you're waiting for that to happen. And don't underestimate them. These are high yield endeavors. And there's probably nothing earth-shattering, but it's all evidence-based. I've seen it work hundreds of, not thousands of times. And again, we don't have time to kind of go through it, but the pillars of health are nutrition, exercise, sleep. If I had to choose one, it's going to be sleep to really help you. And better sleep, better you. I was sensitized to this, but I saw a commercial the other day. It's true. A good day starts with a good night. And sleep's important for a variety of reasons. It improves concentration and productivity, so your school performance, your work performance. It is linked with depression and anxiety. It's linked to inflammation, which can cause other flare-ups with schizophrenia or other psychotic spectrum conditions. Sleep improves your immune function. That's extremely important to fight infections of all kinds. And this is the foremost authority on sleep. And their treatment guidelines recommend a form of cognitive behavioral therapy for insomnia called CBTI, not medications. And again, this is a psychiatrist saying medications are not first line. So the CBTI is a therapy that you can walk through and learn how to do it. Again, I might send these slides out to Bethany, but it's a great thing. Here's another thing, thanks to technology. This is a free domain app created by a coalition of Stanford and the VA Department of Defense. It's a CBTI app that you can get on your phone and work through CBTI on your own with very good effect size and results. So if you have sleep problems, I would recommend this, or you know somebody that has sleep problems, this would be a good thing to try. So again, we pretty much know sleep hygiene. Again, you can get a lot out of this. In my experience, the big 3 are limiting your caffeine, keeping to a routine, even on weekends, and watching the devices at night or putting on the screen filter for blue light blockers or the glasses or what have you. I wouldn't be a good psychiatrist if I didn't warn you against using drugs or alcohol during these tough times. They just add fuel to the fire. And also how important staying social is and connected to your loved ones, your family, your friends. That's therapeutic. Don't fight the urge to isolate yourself. That's not going to help you. And again, if you needed any reinforcement of the things I just said, that same survey, Medscape, that does for psychiatrists, look what they do to maintain their happiness and mental health. Everything that we just mentioned, socialization, exercise and sleep, eating healthy.